Hello, I'm Justin Wilkie,
And I'm Ian Jones.
and today we're going to talk about Ecuador's healthcare. In general, Ecuador's healthcare is somewhat similar to the United States, in that according to the World Health Organization, their average life expectancy is 78 years, which happens to be the same for the US. Both countries also have the same leading cause of death, which is heart disease. Some differences between the countries are that Ecuador is more susceptible to getting malaria and dengue fever due to the tropical climates they have, causing a lot of mosquitoes to live there. Obviously, this isn't the case for the mountainous regions in the country. Another difference that the countries have is that Ecuador is more focused on preventative care, while the United States is focused on just treating the patient.
In terms of actual access to healthcare, Ecuador has a lot of free clinics around the country, with general and specialty hospitals, especially in the Quito region. Health services are kind of varying by region, with urban areas having a lot more general hospitals and specialty hospitals. Peri-urban areas have more community health centers, and they do still have a number of pharmacies, but the rehab centers, they don't have rehab centers there because just of the costs involved with maintaining those. Rural areas have much more limited access to healthcare than those previous two. Again, healthcare in Ecuador is actually quite cheap. It's about $20 to see the doctor or $30 to see a specialist. Now we'll take you to someone who has personal experience with the Ecuadorian healthcare system.
I'm here with my friend Alex Arias. Now, Alex, I understand you have a special relation to the country of Ecuador. Would you mind explaining that for our viewers?
Yeah, thank you, Ryan. So my dad is actually from Ecuador, and I actually had the opportunity to travel there this summer.
Interesting. Now, we're here today to talk to you about Ecuador's healthcare system. And obviously, you traveled there. So do you have any stories or experiences that you would like to share with us?
Yeah, so as far as where I was staying in the area that I was at in Ecuador, there's actually a lot of clinics that were set up around the area, and they all were free because they were covered by the Ministry of Public Health. And along the lines of general hospitals, they also have those set up around. I would say it's similar to the U.S., but just obviously on a much smaller scale.
Yeah.
But it was still there.
Uh-huh. And that actually sounds a lot like what we learned in class. You told me before the interview that you have a cousin that's a doctor in Ecuador. Did he share any stories with you when you were there?
Yeah, so he is kind of viewed as like a very respected individual in the area that he's at. And basically, all the people there, they seek his help. They love him. They go to him for everything. And he loves what he does, and he just really knocks it out of the park for everyone there.
Well, that's very insightful. I appreciate you giving us your time and doing this interview for us. So, thank you.
Thank you.
Hello, my name is Kenny.
And I'm Ryan Duke. And you actually may recall that Dr. English mentioned in class that healthcare is a guaranteed right by the Constitution of Ecuador. Included in that, the Ministry of Public Health accounts for 30% of all the population, and it gives them free healthcare. The service has been expanding over the years. They also have a private insurance, which accounts for 20% of the entire population, and that's perceived as better than the Ministry of Public Health insurance. They have a social security system, which accounts for 18% of the population, and it's for those that are employed. Recently, they have been adding families to that policy. Other than that, they have the armed forces accounts, which are like people in the military get their insurance paid for, and that's 2% of the population, whereas they also have non-governmental organizations, and that accounts for 5% of this population. Unfortunately, though, according to PBS, 20 to 30% of the population actually lack an immediate access to healthcare service, and that would, going back to what Ian said, account for like the rural areas.
Now, speaking of rural areas, since there are less materials, or I should say resources, for people to access medical care, they have to rely on shamans. Now, shamans are pretty much top-of-the-line people in the rural area who are taught from an early age on how to treat people when medical services are pretty much not around. So, but there are still medical services that are around in pretty much every big city. In Quito, there are medical schools that are opened up and are open to any students who are interested. But many specialists, though, tend to train in foreign countries in order to properly get licensed. Now, indigenous people that live far off in the mountains, though, will have to get their medical services in cities. So they have to travel all the way from where they lived in and to pretty much any nearby cities with a hospital or clinic. They have a large focus on community-based health, and there's more focus on a group, but not so much on an individual, and that was mentioned earlier, which was in contrast to the U.S. Ecuador has more of a preventative healthcare system that focuses on the community. Now, all in all, top of the line, Ecuador healthcare is comparable in some ways to the U.S., and it's actually much cheaper. However, the downside is that there are less people in rural areas who have access to healthcare services.